the record button, please.
George, before you do that, can you make sure that anyone who's not you and talking is muted?
Yes, I can do that.
Thank you.
Okay.
It's right there.
I'll mute everybody.
Okay, I just pushed mute everybody, so that should work. And we are here ready to start the meeting. I call the
George, you muted yourself. Sorry.
a big sign, unmute George. Okay. Okay, now this everybody can hear me. I'm calling the September, don't I wish, August 10th meeting of the Mashpee School Committee to order at 3 o'clock this afternoon. Our first order of business is the Pledge of Allegiance. And once the flag comes up, we will do that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And first order of business is to ratify the agenda for this evening, for this afternoon. Take a motion to ratify.
So moved.
It is moved by Dawn. Is there a second to the motion?
Second by Nicole.
Second by Nicole. The motion has been made and seconded. Any discussion on the motion? Hearing none, call for the vote. Kathy?
Yes.
Jeff?
Yes.
Dawn?
Yes.
Nicole?
Yes.
And George, yes. And now we are open to the public comment section. If you are a member of the public and you would like to make a comment, down along the bottom, you'll see a little thing that says reactions. If you just want to click on that, and you can raise your hand and I can notice you that way. I've got a couple of screens going on here, so I may not necessarily see a wave. But if you wish to speak, just go down to the bottom and where it says reactions and just put your hand up and I'll call you. I'll give everybody a minute. And if there's a member of the public that wishes to call in, the phone number is 1-646-558-8656. Okay, I'm not seeing any hands. And there's no phone calls, so we'll give another 15 seconds or so. And hearing nothing, we'll move on to the next item on the agenda, which is the approval of minutes of July 29th. May I have a motion, please? To approve the minutes.
This is Kathy. I make a motion to approve the minutes.
Thank you, Kathy. A motion is made by Kathy. Is there a second?
I'll second.
Thank you, Nicole. Any discussion on the motion? Hearing no discussion, I'll call for the vote. Kathy?
Yes.
Jeff?
Yes.
Thank you, Jeff. Dawn?
Yes.
Nicole?
Yes.
And myself, yes. Passes unanimously. I'd like to welcome a couple of people from the town here, Don Thayer and the town manager, Rodney Collins. Thank you for joining us today. We now have information on school opening supports from DPW, Dr. Parkinson, and Kate from the Board of Health. Do any of you three have a reason that you need to get out of here early and would like to be first? Otherwise, I'll just call you as you're on the agenda. Hearing no objection. Catherine, you're first up, please.
Hello. So we are underway with plans to reopen. I don't know if there are specific questions, but we are, as discussed, we are adjusting the HVAC systems to allow 100% fresh air intake and eliminating the recirculation of the air in the classrooms and the offices. Hand sanitizer has been ordered. Our plan is that hand sanitizer will be located outside of each classroom as well as at each entry. That appears to be on target for potential reopening on September 16th. Storage containers have been delivered as of today. We're starting to get those trailers in to temporarily store the excess furniture that has been emptied out of the classrooms. So that is going to be underway over the next couple of weeks. We've met with our architect for the medical waiting rooms. So we're waiting for those final plans, and we will start, I guess, implementation of what's needed for those as soon as we have a sign off from the building and fire departments. We have ordered the partitions for all of the administrative office spaces. I unfortunately just received notice from our vendor today that those are not expected for another 8 weeks. So those would not be in place prior to the proposed start of school. We have been trying to locate hand wipes or wipes so that student desks, the cafeteria desks, can be wiped in between. Those are all back ordered. The earliest we're expecting anything is sometime in October, and they can't even give us a guarantee on that. There is still some questions. I did get the schedule from the superintendent. So I think we need to just have further conversation in terms of what's expected for disinfecting. We had mentioned that we need 15 to 20 minutes for disinfecting, and according to some of the schedules, we don't have that time. So that is something that would need to be addressed. Another question for the elementary schools is at recess, the disinfection of the playground equipment. Who's going to be responsible for that, if that's something that the recess monitors are going to be able to assist with or not. I know the superintendent has asked about additional custodial staff. I had a meeting with the town manager, and I think he'll speak to the process for us to bring on additional staff. But that is something that would need to start, I guess, sooner rather than later if we were going to have that staff in place for the beginning of the school year. So I think that's most, I guess, a general overview, unless you had specific questions.
Okay. Thank you very much, Catherine. I would like to say to everybody that's here that has not been involved in this process, that a shout out really has to go to the town manager and Catherine and Brad and all of their crew in attempting to pull all of this together. We have been inundated with changes to what we thought was going to happen, which necessitated additional changes, and everybody really has been, from the town side, has been tremendous support to the school department. I just want to thank everybody for that. Rodney, did you want to speak to the hiring of the additional custodians?
Can you hear me?
Yes, I can, sir.
Okay. In terms of, I think we're getting feedback.
We're there.
Testing. we're gonna have to get rid of this one. How's that? Can you hear me now?
Much better. Yes, sir. Thank you.
Sorry about that. We were having some technical difficulties. I would certainly return the shout out and say that the superintendent and her staff, and specifically the principals, have had some very productive meetings with us. I also want to thank the teachers union for coming in and having some open and frank discussions with us. So I really appreciate the communication there. As far as additional staffing, I think the school committee is fully aware of this. But on the first shift, we are running one at the middle high school, one at Quashnet, and one at Coombs. On the second shift, we're running 4 at the middle high school and 3 at Quashnet and 2 at Coombs. I think what the school is looking for is additional staffing at the day shift or the first shift. And the town is certainly not going to object to that, except for the fact that we do have to have a funding mechanism. I did speak very briefly with the superintendent, and I would suggest that the possibility exists to do this through the COVID money. We just have to make sure in terms of what the end result is going to be in terms of dollars and cents. And we have to make sure through the accounting department that the funds are available for that. Also, if we were to add any additional staff, the question would be obviously whether they would be temporary or permanent, and the town obviously prefers temporary or substitutes. If any additional funding was necessary that were not readily available, there is another option for the town to explore, and that is it's not too late for the Board of Selectmen to add an article to town meeting. And I would respectfully request the school committee's support and the superintendent's support in seeking that through the Board of Selectmen to put that article on for the October town meeting. We generally will not do a financial article in October, or we try to steer away from that if possible. By charter, the primary financial articles are supposed to be in May. But if we had to do it, and it was the only alternative, and there was a funding mechanism after checking with the finance director, it is a possibility to bring forward in October.
Thank you. Thank you, Rodney. Any questions for the town manager, first of all? I'll see you at 6:30, sir.
Yes,
On
looking
the
forward
agenda.
to it.
Pardon?
Looking forward to it.
Likewise, sir. Nicole?
You have to raise your hand, Don. Quick question, Rodney. This is Nicole. Don mentioned the plexiglass barriers that were delayed. I assume the same order is for your offices as well. Is it town-wide, basically? Yes. So yes. Can you help maybe anyone watching understand the added precautions that, what was the purpose of those barriers? If everyone in the school, and maybe Patty can address this too, if everyone's masked and 6 feet apart and we're not having volunteers or members of the public, then what are the plexiglass barriers meant to address?
Great question. Obviously, first and foremost, when somebody is entering town hall, which right now they're not doing because we're not open to public access, we would expect anybody to be wearing facial covering and to maintain a strict social distance when they come in. In addition, for the safety and the protection of the staff, the plexiglass has been ordered through DPW. I believe initially it was anticipated to be arriving and installed somewhere around the middle of August. There's been a little bit of a delay with that. I would also point out to the committee that the town's position right now is, even when we get to that point, what we're going to do is do a slow reopening. What what I mean by that is we're going to have appointment only for the public when they come in to town hall for conducting business. The majority of our business, unlike maybe what you're dealing with, can be done online or through a simple telephone conversation or through some sort of an appointment that would be the exception and not the norm. So to answer your question, the plexiglass and the supplies that have been ordered are there for the protection of staff and to make sure that there is a little bit of an additional separation between staff and the public that is coming into town hall for any kind of business.
Can I just add, in terms of the school areas where we were putting them at basically the reception counters in each of the main offices, if they're not there on time, there will be no employees sitting within 6 feet of that. Already at the Coombs School, all of those central office people are back away from that counter, at least 6 feet or more. The only one was in Quash, and there's room to move a desk in the back, further back for her. And the high school as well, one person could move her desk back, but there's no one sitting right there to be exposed to someone standing there with a mask on.
So just to follow up then, so that the impact of not having those barriers is that we just have to move some furniture around, but otherwise it doesn't affect what we were planning to do in terms of protecting staff.
Yeah, I think we can still keep the staff safe who are sitting in those areas where we're going to install the plexiglass.
Okay, thank you.
Thank you. Don, did you have a question?
Yes. Thanks. I had a question for Rodney. In regard to, you mentioned the finding a funding source. This is other than tapping into the town's free cash. Can you hear me?
I can now.
Okay. Let me repeat the question. So the funding source you were talking about finding, this is other than finding or tapping into the town's free cash or rainy day fund at this point?
I think I got the question. I would want to, I'm sitting here with the finance director. I'd certainly want to consult with her because I just want to make sure that whatever free cash amount is being referred to is certified and that we're not just speculating. And I want to just make sure that it's not intended to be earmarked for something else. And we always like to, as you know as well as I do, and by the way, Don, I almost didn't recognize you with the beard, but that's okay.
Christmas is coming.
Yes, yeah. So what I would like to obviously maintain is our AAA bond rating, and I'd want to always maintain at least $3.5 million, if not more than that, in the free cash level. And the finance director is nodding yes.
And there's also a process involved.
And again, there's obviously a process involved that we would want to follow.
Certifying it, because right now we don't have any certified.
And right now, as she's giving me the friendly reminder of, we don't have any amount that's certified as I speak. Now, is that anticipated? Of course it is. But as of right now, I don't have any certified figure.
What is the deadline that is it 30 days prior to the meeting?
Well, the selectmen have a lot later than the deadline we've already passed for the department heads and committees and commissions, as you know, Don.
Right.
Wayne, do you know the exact date?
Around September 14th.
It's around September 14th, but don't necessarily quote that date, but we can get you the exact date. Can you check with Terry real quick?
But that article would come from the town with the support of the school committee?
Yes, what I would look for is the selectmen to introduce that article, and I would certainly recommend it, but it would be helpful to have the support of the school committee. And it is the 14th. Wayne just confirmed the date.
Thank you. Kathy or Jeff, any questions for the town manager? I'm going to either demonstrate brilliance or total ignorance, probably the latter. With those 3D printers, I know that they were making some shields, face shields for the first responders and that type of thing. Is that something that could be used to for these type shields, or am I just totally?
Maybe Principal Balistracci could comment on that. I don't know how big it makes things or you piece things together. Do you know, Principal Balistracci?
Good afternoon. Hope everybody can hear me.
Sir.
So they made the headbands for them for the shields. They make that out of the materials. I'm sure that if we needed to and could get the appropriate materials, we could make them for staff in those offices. So if that was something we needed to do, I'm sure we could make that happen.
Just a thought.
Yep, a good one. Thank you.
Thank you. Any other questions for the town manager? Thank you very much for coming, sir, and I will see you about 6:25 this evening.
Thank you very much, and stay healthy, all of you.
Likewise.
Thanks, Mr. Collins.
Thank you.
Questions for Catherine?
I had a quick question for Catherine. This is Kathy. So you mentioned that those wipes are back ordered until October. What is the plan? Like, what are you planning to do until then? Like, what are we just going to use what we normally are using? I mean, is it a little bit more high strength? Like, what's the plan for that until they come in?
I think that's a further conversation that we need to have with school staff. The intention was that teachers and students would be doing that in the classrooms, just because even with additional custodial staff, we're not going to be able to do that. So the disinfectant that we have available now, it has a dwell time of 10 minutes. So that's where we were coming up with the 15 to 20 minutes in between to allow the proper disinfecting. So that would affect the schedules that the schools have already come up with.
Well, I think on the lunches, and I know there's all 3 schools, but the high school plans to alternate between the gym and the CAF, so you should be able to clean there because one space won't be used. And I don't know whether the Quashnet School ended up with that plan between the gym and the CAF.
I believe so, but I think the question we had, Patty, was at the high school in particular, where you are expecting that the students are switching classrooms for each block.
Yeah, the desks in the classrooms. That's right. I know that our nurse coordinator, Stacy Shackle's on here in terms of, there were conversations today because of the delay in those wipes of whether some type of a soap and water. I don't know where we landed with that. Stacy, are you on here?
Hello, yes. Soap and water doesn't meet the criteria in checking with Caitlin, and Caitlin, you can interject too, for infection purposes, but the cleaner that Barnstable Public Schools is using does appear to be safe. So I know Brad, Catherine, you have that. Again, I agree, Catherine, we need to further discuss this to look at seeing if we can order that as an alternative to use for those desks. But I'm actively researching it, and moving forward, hopefully we'll find something. But it is it's an ongoing process.
Right. I think that by what Stacy sent, that's a 5-minute dwell, so that does cut down on the time. But the question would still be who's I guess spraying the product, who's wiping the desks. Is that still something that either the teachers or the students would be able to do?
Yeah, I definitely think it's only an issue at the middle high school where they're going to go to 4 different classrooms in their day because of the block scheduling. There's not a way that I would expect a custodian to be able to handle that task. So it will be something that the students and particularly the students will be involved with for their own desk that they will be sitting at for each 85-minute class. So they have 4 of those in a day.
Okay, thank you.
Okay, Jeff, any questions? No? Okay, Don, I know you said you had another question here for Catherine.
Yeah, Catherine, can you talk a little bit about the sanitation process um, it sounds like we're going to be sanitizing hard surfaces. What about the air? What's being done, if anything, in regard to um, the the air in the classrooms? I know you're talking about 100% fresh air. Is that accomplished through our ventilation system, through having the windows open, which works until it gets cold, or just can you elaborate in regard to that whole process?
So during the school day, it would be a combination of the ventilation system, the mechanical ventilation system, as well as the windows where available. So we are either manually or overriding the controls for the systems to eliminate the recirculation of air and converting it to bringing in 100% fresh air, which is then exhausted. There are existing exhaust systems in all of the space, which exhausts to the outside. That is something that we can do through probably sometime in November, December, as the outside temperature starts to decrease. That is something that we're going to have to discuss further, because continuing to bring in 100% fresh air in cold air could potentially freeze the systems, so that as we get into the colder months, we'll have to reevaluate. And then my understanding is that windows will be opened, doors will be left open to also, I guess, bring in additional fresh air. And then at the end of, I guess, once the class day is over, we will have our normal cleaning that we do, throughout the space. And then we've added a disinfecting. So we've purchased equipment that will actually we will go through every single space in the school. And this is what we're going to be doing during the lunch periods in between, is I guess, sprays a disinfectant in a mist form. So it treats not just, I guess, every single surface, not just the wipeable surfaces. So we'll be doing that each night as well.
And that'll cover the entire interior of the building?
Correct. That is our plan. Yes.
Okay. In regard to the discussion about additional potential custodial staffing, obviously it sounds like that would be dedicated to the disinfecting that has to be done, both inside and obviously outside, potentially at the playgrounds. Have you and the superintendent discussed how many additional staff would potentially be required?
So I think we will have further conversations. We're looking at probably at least one additional staff at each school during the day. Someone that will be disinfecting, and then the other additional staff person would be going around doing additional cleaning of the bathroom facilities, wiping down any touch areas during the school day. I think we're going to have to evaluate for second shift, because we are adding that disinfecting component, whether that's something we can do with existing staff, or if there's going to be a need to bring additional staff at each school on second shift as well. So anticipating at least one, if not two, between the two shifts at each school.
Plus my thought too, related to grades 4 through 12 that are hybrid, at least within every classroom, there are half as many kids there. So my mind would say it should be half as dirty at the end of a day versus when there's 20 kids in a space. So hopefully that might help a little bit streamline the nighttime load.
Who is going to be covering the buses and sanitizing the interior of the buses?
That's done
every day.
The Cape Cod Collaborative. We've met with them. and they have protocols in place for doing that. The bus drivers do it between runs, and then they also get the bigger mist disinfectant at the end of each double run. So they can't mist between the first run and the second run of the morning or the afternoon. There's not time, but they are able to wipe down sort of the touch areas, and then they will disinfect with the mist after the morning run and after the nighttime run.
So the collaborative, or I guess Mashpee is purchasing that equipment to do that at the where the buses are stored at the high school.
Yeah, well, since we own the buses, I guess it does come down to us, but yes.
Yeah.
Oops, sorry.
So I guess to me, one of the open questions is in regard to the playground equipment, and that would just be cleaned during the school day or before and after recesses. Is that your thoughts, Superintendent?
So I think that both of the elementary schools have sort of a cohort mind in place in terms of how kids are grouped or playing, but they could also end up being just predominantly on the field area, running or playing different types of games that way where they may not be on the apparatus. But we do have recess monitors. I just don't know timing between usage would be very efficient with cleaning. I guess there are certain hotter areas they could definitely wipe down.
All right, thank you.
Thank you, John. Nicole, oops, you're already muted.
Thanks. So a couple of questions, just to follow on with that last question about the playground equipment. Can you, I've heard parents chattering about what playground play looks like in this sort of safe environment. I mean, are we expecting kids to maintain 6-foot distancing from each other on the playgrounds, or is it more that cohort approach that they recess with the kids that they're in their classroom with and you're trying to kind of keep the bubble tight?
I think it's a combination of both. I also look at the busing where if you go at a diagonal, they're technically 6 feet apart, but it's a little less than the 6 feet apart. So I think definitely having the cohort staying together, masks, depending on, like if you're out on the field, you probably could play without your mask if you're in a tight confined sort of zone of a cluster, but there will be a limited number of students at each playground. I don't know if Principal O'Brien wants to talk about her vision or what she's sort of thought about in terms of recess, at least at the Quashnet School.
Sure. There is a 15-minute break in between every recess and every lunch based on the guidelines that I was given a while back. And that 15 minutes would allow for some disinfectant of those areas. But I think most importantly, it is a cohort model. So the way we have the specials structured right now, students, the same group of students will all be going to art, for example, for the 5 different periods. Those are the same students that would be sharing the same lunch area and the same recess area. So all students wouldn't be exposed to multiple classrooms. They would be exposed to 5 classrooms of students somewhat. And even then they are spread out, but it's not the whole 3rd grade, for example, or the whole 4th grade that would be going outside at the same time. In order to really provide for that distancing, it is in smaller groups, whether it's in the lunchroom, whether it's in the hallways, whether it's outside on the playgrounds.
Okay, thank you. I just wanted to follow up on that because we were talking about playgrounds. I'm sorry, I did have a question for Catherine. So I understood that earlier in the summer, the bathrooms were all that weren't already converted, were converted to hands-free. So we don't have any required touching to flush toilets or wash hands or dry hands. Is that right?
That's correct. We still, all of the faucets and toilets, urinals have been converted. The Hand dryers are not allowed, so we will be replacing the hand dryers with touch-free paper towel dispensers. Most of the bathrooms are designed so that there isn't a door. The door can be propped open, so you're not touching the door as you enter. So I guess the only touch surface potentially would be just the stall doors. So that might be a focus for a first shift custodian to disinfect those areas on a more frequent basis.
Okay, thank you. I just wanted to make sure that was done. Thanks.
Okay, and Don, you have one more question here?
Yeah, I'm just following up in regard to like the playgrounds. What about the athletic fields? Is any additional sanitation or disinfection going to take place for the athletic fields, assuming that we have athletic activities? And who's going to do that?
I don't know about disinfecting out in the field itself. I think we'd have to wait for guidelines. Anything and everything related to athletics have to come out of the Department of Education as well as the MIAA. So right now we don't have any information related to that.
All right, so more to come on that, it sounds like. Thank you.
Okay, one last, okay, Jeff? There you go.
Hey, everybody. Yeah, you confused me. You're automatically unmuting me, and I get easily confused. I just had a question about our interchanging use of the word cohort. I just wanted to make sure that we're not confusing anybody. So I know in the plan that was a very specific definition of a cohort, and it was for the people who were on hybrid, and it's how they were split between Mashpee and Falcons. That's the way they defined it. So now we're talking about cohorts going to the playgrounds. I just want to make sure everyone understands when we say a cohort, it's not the cohort that's Mashpee Falcon, it's some other.
No, so at
Yeah.
at the elementary schools, within each homeroom, that's also a cohort of students. So whether it's the 11 students in the in-person model at Coombs or 14 or the 10 in the hybrid model at 4 through 6, those in terms of like specialists who interact with kids, they're going to refer to those as cohorts too. So yes, there would be a little confusion there with that word.
So then going back to what Principal O'Brien was saying, the group that goes out to recess together is who?
Those are homeroom groupings.
A previously determined number of homeroom groupings. It's always going to be the same group together, right? Is that the group A, B, C, D, E, F? Or I'm sorry, A, B, C, D, E, or whatever the letters are?
Yes.
Because they are defined somewhat. Okay.
Yes, on her schedule, yes.
Yes, it would be those groups.
Okay. All set, Jeff? Okay. Last chance for questions for Catherine. Seeing none, Catherine, on behalf of everybody associated with the schools, please pass on our thanks to, well, you obviously, and to Brad and to all of your crew for all of the work that you've done to get us ready for this this school opening. Thanks again.
Welcome.
Thank you, Catherine.
Thank you, Catherine.
Yeah,
Next
thanks,
up
Catherine.
is Dr. Parkinson.
Yeah. He is here.
He's
Hello.
here. Hi there.
Can you hear me okay?
Yes, I can, Doctor. Thank you.
Yes. So from my point of view, I think I think I would just say that, taking a step back, the amount of preparation that everyone that I've been, party to discussions and multiple emails, the level of attention to detail has been really, pretty exceptional. And I think that, and I think that's great. I think that gives a fighting chance, I guess I would say. Looking at what's going on all across different places, I think we have to keep in mind that we are somewhat at the mercy of what's going on around us. And that I find myself a little bit like a weather forecaster trying to advise people what to do tomorrow based on yesterday's weather. And I think, and then I think about, you hear all things, they've done well doing this in China, they've done well doing this in Germany, they've done well doing this in Scandinavia, they've not done well doing this in Israel, they've not done well doing this in the southern US. And that's a combination of how well the world around them is doing and how well they're doing, at sort of protecting their house. And I think, within the limits of what can be done, what Stacy and everybody have done to do that, I think you've done as well as anybody I think reasonably could do. And you continue to ask those questions that you're asking today, and that's good. I do fear that if a storm comes from outside of the school, that we're going to get swept up in it, and it's going to be beyond anybody's control. And I think if this doesn't go well, that's an important perspective. And I think, on the other hand, if the weather is reasonable, this kind of, fortifications and preparations you made will hopefully make it so that it can go successfully. And keeping in mind that this is not a neutral decision, as you know, there's all kinds of ramifications for not trying to do this. So I think I would limit my remarks to that and then entertain any questions anybody had.
Kathy, any questions? Jeff, any questions, sir?
No, thank you. I'm good. Thanks, doctor.
Okay. Dawn, questions? Whoops.
So help me understand when you talk about a storm coming. Is that one case, 5 cases? Because I hear of neighboring towns and districts canceling significant events because of potential things happening.
Right. So that's the whole. I don't know, and I think if you look at the numbers in Massachusetts and what they've done in the last month, we all know that they've gone up from sort of 200-ish cases a day, a month or 6 weeks ago, and then peaking sort of into last week, seemed to be up to sort of north of 400 cases a day in the state. And the last couple of days, I'm hoping, I'm reading into it, it's dropping back down a little bit again, and people maybe getting past the 4th of July rush and what that impacted. And so, that's when I say the difficulties. I don't know. I can tell you that if we have an occasional case, everybody has shown that doing contact tracing and sort of putting things out when it's a small problem is infinitely easier than if it gets bigger. So and it depends both on how many cases are in the community and what the turnaround testing is. There's a frustratingly slow turnaround right now, which, I don't see a practical change to in the next 6 to 8 weeks. I think a lot of people are trying to gear up privately, even at my own office level, to get our own testing equipment so that we can provide turnaround. If the state could come through with testing that would be point of care at the school level. That would be game changing in terms of the ability to answer your question better. So, I think it's open to individual interpretation what represents a storm.
All right. I guess the other related question is, I'm concerned about potential false positive identifications where we may send a child home or may
Yeah, that
out of paranoia.
I as a physician, I'm worry much more about false negatives. So the false positive rate, there's always, with any test, there's, and my understanding is that the false positive rate, it's going to be specific from test to test. And it's going to, some of the really, really accurate tests are not so much falsely positive as they may detect remnants of an infection, which is sort of long since passed, because they're pick up such small.
So let me clarify. So you're taking it to the next step. What I'm talking about, a bus driver identifying a child having, coughing when they get on the bus, or a school nurse identifying a child who potentially has symptoms that may be similar. And so therefore, we're requiring either the child to stay home and quarantine, or we're requiring potentially them to undertake testing, which may or may not turn out to be positive. And so that's my concern.
That is a very well-founded concern, to which I know of no good solution, because you cannot say that person that's coughing who has asthma couldn't also have an infection. You can't, and you don't want every kid with a runny nose to be excluded or tested, obviously. But if somebody has a fever, and it's not all going to be COVID. And so, yes, are there going to be kids excluded? It's going to be very, very difficult, because there are going to be kids excluded, and there are going to be kids excluded who turn out to have other things. I'm not aware of any way to distinguish those, and because of that, I'm not aware of any way that there's any choice but to do that. But it's going to cause significant grief for everyone, not the least of which is families.
Unfortunately, it's not a great answer, but it's the only answer we got. So
I wish we had, if we had point of care testing that was quick and we could get the burden down in the community, then you're dealing with a much lower likelihood, and that would make it possible to make a safer allowances for returning kids to school. But right now we just don't have that.
All right. Thank you, sir. That's all my questions, George.
Thank you, Don. Nicole?
Thanks, George. Dr. Parkinson, so nice to have you here. Thank you so much for being here with us today. And we're so proud to have you as our school doctor, our school physician. So thank you for that. You mentioned a few minutes ago, and I didn't catch the terminology, but you were saying that something would be game changing in terms of testing that was available at the schools. Could you restate that for me?
So, I saw a graph the other day which shows you the likelihood of spread of a given positive person depending on how long it takes them to get their test result. And the problem that we're dealing with right now is we test somebody and although the test might take 15 minutes or 45 minutes to run, there's such a queue to get them done that we don't get the results for 2, 4, 7 days. And by the time 7 days later, as you are, I think all are well aware, that's a problem. So, if there was a way where people could get tested and results on the day of, that would be so much more helpful in terms of, contact tracing and who to exclude and, and limiting spread. It's not available currently. So.
And you referred to it as something, though, that type of testing.
Oh, point of care. It just means that's just a generic term used for the person that you don't have to send it out to somebody else to get a result.
Gotcha. And then the other question I had is, our kids currently have requirements to get certain vaccines, prior to starting school. Every kid, or you can, some places allow for religious objections, et cetera. But, I diligently take my kids to get a physical every year, so they're caught up in their vaccines so that they can attend public school. Have folks in your profession been talking about, the alteration of those requirements in this post-COVID world and sort of what it might mean for families once a vaccine is available, or even the sort of related association with a flu vaccine? Has that come up at all?
Yeah, yes, it has. And, there's a couple of points there. The first thing is that, there was a big worry in March and April when things were very, very restrictive in terms of, there was a group of kids at that point who didn't go for their well visits, and therefore didn't get their immunizations. And every practice I know has been working, double time trying to get all those kids caught up, so that they, that they are up to date, because the risk of a measles outbreak or a whooping cough outbreak or something like that is not trivial, and quite honestly is more of a risk to children than COVID is. And so it's very important to keep in mind that, we're immunizing, we have these things at bay because we stay alert and on them, but it doesn't take much, as we've all seen in previous years, in terms of a lapse for that to slip. So because of that, the DPH has not, as you probably know, made any allowances to the immunization schedule in terms of what they consider to be up to date. And that, that's a real challenge. And, it's going to be yet another burden that the nurses are going to encounter. But you can see why they're doing it, because they know that these other illnesses are a risk. It's already been shown that the incidence of lead issues across the country have gone up since COVID, because of societal things and testing things related to that. So these, unfortunately, COVID doesn't operate in isolation.
You're muted, Nicole.
Yeah, thank you so much. That does help answer my question. And I guess the other ones I will save for after we have a vaccine.
Thank you, Nicole. One last chance for any questions for Dr. Parkinson. Not seeing any. Doctor, thank you very much for coming here today. Really appreciate
You're welcome.
the time and your wisdom.
Well, I'm not sure about the latter part, but I will say in parting that, I've witnessed firsthand that the children can wear their masks most of the time with the right kind of coaching, and that that we can't control other than being cheerleaders for the parents trying to help their kids with that. The more we can make our staff anxiety levels lower, I think the more they can get on board, because they're going to be so important for helping the kids to execute what they need to.
Thank you.
I'd like to thank Dr. Parkinson, this is Patty DeBoer, for just your continual input to every question related to this experience that we're going through. I really appreciate you being a part of our team.
Well, I appreciate Stacy putting everything on a silver platter, so I just have to nod one way or the other.
That is true. We do have an extraordinary person in Stacy.
Thank you, Stacy, too.
Thank you, Stacy.
Hey, George, George, I do have one last question. I'm sorry.
Go ahead.
So I've heard in our plan, there's going to be mask breaks where I read into it that means the kids will not be wearing their masks during certain time periods. How do I get comfortable with that versus having them wear them? Because I'm hearing from the state, everyone should be wearing a mask if they're in public. And I don't hear an exception to that. So can you help me rationalize that?
I think that's the perfect setup for what I last said, and I know Stacy has been going on that. I'm going to see if she'll take that one.
Thank you.
Hello, thank you. So you're right, Mr. Myers, masks are important. It is part of the whole stop the spread. We've done a lot of discussion on what constitutes a mask break. We're going to do a lot of education with having people learn how to do one correctly, making sure that they're done. If people need a mask break, you need a mask break. But as Dr. Parkinson said, with teaching, I'm encouraging, and some of my staff that are on here have been listening to me for the last couple of months now. I've been encouraging people, if you've not worn a mask or not gone out, like practice wearing one at home, getting used to it. You'll build up your tolerance. So our mask breaks right now, definitely during eating times. If you look at our schedules, they're built-in natural breaks. So at snack time, lunchtime, those kind of transitions, they will be done if they're in the classroom. Everyone is at their own desk. They're facing the same way. Address the HVAC component. They'll be brief, 5-10 minutes max. Everybody will be doing it. It'll be during a quiet activity. No one will be walking around. There's a lot of thought that's gone into those. And then obviously, things happen. And if somebody needs an extra one, we're never going to say no. Someone needs one. But they are going to be done in a controlled, well thought out schedule, so to speak, if that answers your question.
Well, it answers the question in regard to why you're doing it, but it doesn't answer the question in regard to the safety of doing it.
So again, if you go out to a restaurant, obviously people are not keeping their mask on out in public for that. So because they're eating or drinking. So there has to be some kind of give and take, and then putting the parameters in to make it safe. So is it ideal? Would I love to see a mask on 24/7? Yes, those of you who know me know when I'm out, I always have one on, and it's usually, whatever, making sure it's there. It is important, but I think we also have to balance the environment and what we're doing. I honestly think, as Dr. Parkinson said, eventually we will see that it's really going to be at times when it's a natural break, such as eating, drinking your water, something that you actually have to take a mask break from.
Okay.
And there will be, like at summer school, I worked summer school this summer, so kids and they were preschoolers in my building, they kept their masks on, and it was not an issue. And they took it out for snack and put it back on. Kids are resilient. It's really amazing. I really honestly don't foresee a whole lot of concerns with that, with the right education. And we will again be teaching how to take it off correctly, hand washing, hand sanitizing, where we put it, encouraging bringing a second mask. I believe everybody will be asked to bring 2. If you've never worn a mask for a full day, midway through, it's great to take a change. And we'll go from there.
All right.
Thank you. All set,
Thank
Don?
you. Yes.
Thank you.
All right, one last chance for Dr. Parkinson. Patty.
Well, mine wasn't for Dr. Parkinson. I just wanted to let everyone know that although DESE has the requirement that from grade 2 up, students are to be masked, but we are requiring all of our students to be masked. And like Stacy just said, you know, the kids are resilient, and I actually think the younger ones may have less of a challenge with it than some of our older students, but to protect our staff and make it as equitable for our employees and also as safe as we can, we are going to require masks for all of our students.
Thank you again, Dr. Parkinson. Really appreciate your time and your knowledge here. Next up,
Happy to try to help.
thank you. Next up is Kate from Board of Health. I'm drawing a blank here.
Hi, yes, Kate Gardefee here. I'm here on Glenn Harrington's behalf. He was unable to be here today, so thank you for having me. I'm mostly here just to answer any questions that you may have. Glenn worked with Brad and Catherine at DPW going over the HVAC systems in the schools. So we've been a part of those discussions, as well as regarding different types of disinfectants to be used for sanitizing the desks in between uses. We've also been working closely with Stacy, talking a lot about, you know, if we were to have an exposure in the school, contact tracing, you know, what those protocols are going to look like. And I believe our contact with the VNA, Meg Payne, is also in the conference call right now to answer any specific questions about contact tracing for you guys.
Yes, I'm here.
Awesome. Thanks, Meg.
Yep.
Meg, would you, any other comments you'd like to make, Meg?
Just that we are working closely with the health department as the town public health nurses, tracing all the positive COVID patients along with their close contacts in the town of Mashpee. Just trying to collect as much data as we can and report back to DPH and contain this virus as best we can.
Thank you. Thank you. Kathy, any questions?
No, just thank you for working so hard on all this, and I'm good. Thank you.
Thank you. Jeff, questions?
Yes, and I forgot the first time I spoke, I meant to say thank you to everyone for all the hard work, because the paperwork and stuff that was passed out and the pre-reads were phenomenal, and I appreciate all the hard work. For Kate, I think that my big thing, and I wrote this on the big asterisk next to it, is, can you please explain the connection between the district and the school administration responsibilities and the Board of Health for when we eventually, or we have a case, either a positive testing for COVID-19 in either a staff or a student?
Sure. Yeah, I think that the first thing that we've talked to Stacy about is we're going to be in constant touch about these things, and obviously we would then forward that to Meg if we were to hear a report of an exposure at the school. You know, unfortunately, with the contact tracing, sometimes word of mouth between people, be it gossip or be it well-founded, you know, gets ahead of the reporting on DPH's side. That's gotten a little better as time has gone on, but there's still the potential that could happen. So that communication line being open is going to be critical. And let me think. Yeah, does that answer your question?
So the responsibilities for the district with respect to contact tracing. So we would report a potential, you know, either a positive test result that we were informed of, or maybe we're just reporting a student or a staff member that we have sent for testing or to medical evaluation because of some sort of symptoms. So we report that, and then whose responsibility is it for the contact tracing portion?
That would be Meg. That would be with the VNA. There are She works with a team of people that would then be following up on any confirmed positive cases.
And to clarify, and it may be you or Meg or even Nurse Stacy, but to clarify, that individual, be it a staff or a student member, how does that affect the remainder of the people within their group or cohort or whatever defined association they've had through the school participation?
Do you want to speak to that question, Meg?
Sure. So when speaking with the positive patient, we define what a close contact means, and DPH defines that as someone within 6 feet of you for 15 minutes or longer. And I believe if everyone's following protocol, we really shouldn't have that many quote unquote close contacts, but once they've been identified, we reach out to them, and the protocol for the community is to quarantine for 14 days from their last close contact interaction with the person who is positive. I might, Kate, you might have more information on this, but I think Desi might have like an alternate protocol for quarantine with students in a school setting.
They do. They have it if it's based on cohorts, where it's a little different for the high school because they are going to be moving classrooms and have different students in each classroom. But at the elementary school levels, they would be broken up into cohorts. So that whole cohort for contact tracing purposes would be considered close contacts.
Okay, and I think I did hear from DPH that, and you might have more information on this, if a close contact has been identified in the cohort, then if they test, they can get tested negative, and then maybe their quarantine period is shortened.
Yeah, and that's kind of, we've been discussing that a little bit with Stacy and with our board, just to see if, we want to move forward with that, or if we want to do just as something separate to say that we need to do a 14-day quarantine, and we're still kind of discussing that on our end. But as of right now, there is kind of a discrepancy between DPH's guidance and what DESE has put forth.
Okay, yeah, we, as far as the community goes, it's a 14-day quarantine from their last close contact interaction.
Thank you, Meg. I missed your introduction there. What organization do you represent, please?
I'm with the Visiting Nurse Association of Cape Cod, and with the Public Health Division. We're separate from Home Care and Hospice.
Got you. Thank you.
Yep.
Dawn, questions?
Yes. So as I understand it, one person potentially needing to be tested because they are presumed to have COVID would then immediately affect the entire group. Is that correct?
Not until they get a positive test result. If I believe that's the case. So they wouldn't have to quarantine the whole cohort until that person does become a confirmed positive.
And it's going to take, what, 48 to 72 hours to get the test results?
Depending on what laboratory is doing the testing, yes.
And then I guess from an administrative standpoint, would that entire cohort then flip over to being a remote school group?
Yes, they easily can do that.
So the entire group, regardless of whether or not they wanted to, because that's is that true even at the elementaries at Casey Coons, which I thought was in person?
It is in person, but there will be members of every class that have chosen to be 100% remote. So the teachers are working to create blended learning, and so we should be able to flip easily to everybody being a remote learner for a certain period of time.
If I could interject, might help clarify, or for after this, for those of you, because I understand it's very confusing. But what Caitlin and Meg were referring to is the Department of Public Health guidelines from July 17th on page 6. And Mr. Gorman, if you want to cut and paste those, that would be great. But they address the testing, positive, tested, not tested. And what Caitlin was referring to is in public health, we generally, the guidelines now are 72 hours if you're a negative test that you stay out, and DESI's guidelines read 24. So that's where some of the discussion is ongoing to see if we want to be a little more stringent or I don't know if that's the right word, but conservative to make sure that we don't have somebody come back that may have tested negative, but actually be positive if it were a false negative, so to speak. But that's where those guidelines are. And at the last meeting, when I was sharing about what a close contact is, so that cohort, yes, if someone tests positive, that whole cohort is out, as is any teacher specialist that works with that classroom for the time. So
we have breaks throughout the year where people have a tendency to go out of state. I don't know whether that would continue to happen in today's environment or not. Who is responsible for monitoring that those people have quarantined themselves in accordance to the state guidelines?
So our protocol is that everyone will self-screen. Believing that after this week, we said we would not be doing a paper copy. I don't know if it'll be electronic, but right now everyone will know, staff, anybody that comes into our building, students, families will self-screen. And one of the questions is, have you traveled? And if you answer yes to that, then you need to quarantine for 14 days. We will be paying very close attention to attendance, asking people to be very honest, communicating. We will need to know why someone is absent, regardless whether it's illness or travel or whatever. And then we all just need to work together with that communication, make sure it's ongoing. You know, more information will follow with how we're going to communicate that, but that's just one of the other key pieces to have this all work together and work well.
Thank you. And Nicole?
Thanks. So I'm not exactly sure who to direct this question to, but I guess it was Meg who mentioned and I was just reading through what Jeff posted in the chat. So thanks for sharing that. So regardless of whether you're wearing a mask, if someone in that cohort tests positive, in terms of contact tracing, if you've been in close proximity, which is within the 6 feet for longer than 15 minutes. So we would assume then that a kid would be picked up in that contact tracing. Because I remember previously we talked about how we didn't think, I thought that, I'm confused about the wearing of the mask. So if you're within 6 feet of someone for 15 minutes or longer, but wearing your mask, you're still considered a contact and vulnerable.
Yes, that's correct.
Okay. And I thought Patty or someone just mentioned, so did we tell parents pre-K through grade 3 that their kids were going to be required? I know Quashnet, I heard that at Quashnet, but for Casey Coombs, did parents know that their kids are going to be required to wear masks if they were there?
You're muted,
Patty.
Only second grade. We just recently are sort of evolved into that mindset of wanting to be as fair as we could to our staff and to students, and start out by having them be masked and see how successful we can be with the pre-K, K and 1.
Okay. And then finally, we do have a number of staff who are not Mashpee residents. And we have, probably 140 students. I don't know how many of them are going to be in person or in one of the hybrid models that also do not live in Mashpee. They choice into Mashpee. So how did the protocols change when it's someone who isn't a resident of this town?
I can answer that. This is Meg. So we do the contact tracing for all of the towns on the Cape except for Barnstable, Sandwich, and Provincetown. We cover the rest of the Cape, so it would still be under VNA jurisdiction. If a staff or student lives in one of the towns I just mentioned that we don't follow, likely in this area, Barnstable or Sandwich, then that town health department would be following that individual.
Well, it would extend over the bridge too. We have a number of staff who don't live on Cape Cod.
Then it would be whatever town they reside in, that health department would be responsible for following up with that individual.
But is the school responsible for notifying that town, or do we notify Mashpee and then Mashpee notifies that town, or is it the resident's responsibility?
Well, what's been happening is the physician, when someone goes to get a test, they're suspected to have COVID, they receive the results from their physician, and then it goes through it, everything, all the results, all the labs go up to the state, and then the state would alert that health department. So I guess if you find out about it first, I mean, either way, you could alert Mashpee and we can forward the information over to wherever it needs to go. Yeah, this is kind of unusual. Obviously, we haven't been through that particular situation yet.
Yeah, well, it's going to be happening. I mean, we're not unique in having teachers and staff and students from other towns. So that's going to be happening all over the Cape. The other question I had is about the responsibility of the testing. So is the onus always on the individual that has to be tested? In other words, a child has symptoms. We say, they can't be in school. So the parent has to go get that child a test and produce a negative test result. It's the same with the staff. If they show symptoms or have an issue, then it's their responsibility. But we know that all testing is not equal, right? So the rapid tests that you can get, if you have the money, you can pay to get a rapid test and spend $300. Or if you go to a free clinic, you may be waiting a week. And so I'm just curious whether you guys have encountered any of that variability, and does our public health department advise the town residents to go to one place over another? Or is there any are we being at all prescriptive about what's the most efficient and best way to get testing done once it's required?
Yeah, this is Meg again. So the only test that is supported by the Department of Public Health and the only test that is FDA approved is the PCR nasal swab.
Mm-hmm.
And that is the test that we're recommending. And also the governor is recommending for all, travel purposes, they're recommending or they're suggesting a PCR test.
Okay.
And the individual should be calling their primary care physician for that. I know Cape Cod Healthcare is only offering the PCR test as well.
And are people allowed to get tests in Massachusetts right now without showing symptoms?
If they are a close contact to a confirmed case, then yes, there is an order put in place by the state allowing them to get tested.
Okay. Thank you.
Thank you, Nicole. Thank you last questions, anybody? Okay, thank you very much, Meg and Kate, for being here today. Appreciate your information and your expertise. Thanks for being here. Moving on, the next item of business is the school year 2021 calendar. Chair will entertain a motion to approve the calendar as submitted in your package. Still waiting on a motion, please.
This is Don. I'll make a motion to approve the calendar as presented with the revision date of 7/28/2020 for discussion purposes.
Thank you. Motion has been made. Is there a second to the motion?
I second.
A motion made and seconded. A discussion on the motion. Kathy?
Okay, so we're still gonna have, so everybody will start on Wednesday and then kindergarten starts the next day. We had talked, is there gonna be, like, when we announce the cohorts, we'll know who's gonna go? Because I thought at one point we talked like we're gonna have like the Falcon, the Mashpee kids start like 1 or 2 days, and then the Falcon kids start. Are they all gonna still start on the same day? Like, I guess.
No, we anticipate having some during the period of time when the teachers are engaged in their training, of being able to welcome some students in for sort of an orientation if they feel it would be helpful for them, not necessarily everyone, although anyone who wants to, we can accommodate. So the original plan was on the 16th and the 18th of September. Those would be 2 days of, call it the Falcon cohort. And then the Mashpee cohort would come on the 17th. And then the group that comes on the 17th would be the ones who did their first in-person week on the 21st. So we'll have 2 days with one group that then spends the following week remotely, sort of to get them trained on what that looks like. And then 1 day with the other group that will be in with us the next. So it will be awkward for that first day for one group or the other. So we'll do whatever we can to communicate in advance so that those students understand sort of what's expected of them to connect with their classrooms.
Okay, thank you.
Okay, Jeff, any questions?
I was just curious, and I knew you probably knew I was going to ask this, what the rationale behind putting PD during Thanksgiving week is.
Well, because we felt it might be an opportunity for families. It was more of a family focus.
May I interject as well? This is Hope Hanscom. Hold on, sorry. Is that okay, Mr. Chair?
Yes, you may.
Also, Mr. Gorman, it was what seemed to us to be a good break in terms of implementing the new models and being able to stop and take stock. Okay, it's been 8 weeks or so, and spending those 2 days adapting or adjusting or whatever we need to at that point. So I think it was both of those things.
And I assume that the teacher association's already good to go with this, thumbs up on this new calendar?
Yeah, the association president, Mary Stickley, has already approved this calendar.
Okay.
Anything else, Jeff?
No, because if I start arguing it, people are just going to think that I'm trying to fight for teachers to get more days off. So I'll just keep it to myself.
Thank you, Jeff. Dawn, any questions?
So I do. So in regard to the snow days, why would we have snow days if we're now going to have remote learning capability? I thought snow days would now disappear.
Well, in theory, yes, but that has not been officially declared by the Department of Education, and we've been instructed to include 5 snow days in our calendars. So that's why they're there. They haven't quite let go of that yet, I think, in terms of feeling confident in our remote learning.
And if I may, I would caution that most of the snow days we have, we're pretty conservative. And when we do get snow days, people are sitting around with no power. So it's going to be very difficult to do remote learning.
That's true too.
That's a good point.
Good point, Jeff.
That's my only observation.
Okay, Nicole.
Well, Don stole a little bit of my thunder. I had that question as well. So glad we are on the same page, Don. The other thing that leapt out at me was parent-teacher conferences. I saw that on the calendar. I think it's a very nice goal. Am I just to sort of treat it as, you know, that's when we'll do them if we can do them?
Well, I'm sorry, they're most likely going to be virtual.
Okay, that was my question. Because it was on the calendar, it wasn't clear to me that it wasn't in person, so I thought it sent maybe a mixed message, so, okay.
Mm-hmm.
Any additional questions from anyone on the school calendar?
And just so you know, the date at the top will be revised 8/10/20 when it's put into play.
Yeah, I haven't checked, just my other thought was, I didn't check any of the, like the terms, but have those been affected or altered based on the new start date?
The principals went through and adjusted all of those dates based on the 170-day calendar and the later start.
Okay, great.
Additional questions?
No, I think that was all I had. Thank you.
Anyone else question? Seeing none, I'll call for the vote. All in favor of approving the calendar as submitted?
Hold on, I have one more question. I'm sorry. Sorry, George.
Sorry, I'll have to speak quicker.
Okay, I'm sorry. My only question was, if we do have to close and go to 100% remote learning, will we evaluate the calendar again? Like, can we change it mid-year as we did in disregarding April break, for example, this year and teaching through April break? Or does this calendar, can parents hang their hat on this as like, regardless of what happens, this is what we're doing?
Well, I think this is not the year for anybody to hang their hat on anything. It's going to evolve. I think we've always had that March PD day, which has given us flexibility to move if we needed to if we'd had a lot of snow. The options for vacations, I know parents plan, so those would probably be as best we could protected, but who knows what the situation is going to be at that point. But you can always revisit this calendar if we need to change it. It's
okay.
But we don't want to, but we might have to.
And so the first day for teachers is
right here,
8/31.
Yeah.
Yeah. Okay. Got it. All right. Thanks, George. Sorry.
No worries.
So, one last question. And Patty, for the seniors, I see the graduation is still the 5th
yes.
of June.
Yes.
So the DESE allowed them to drop the number of days off of theirs also on the front end?
Theirs, I believe, is tied to the regular school year. If I'm not correct, I know that Principal Balstracci knows how far back from the end of the school year graduation can be. So I don't think it affects them, except they're basically 10 less days for them as well. I don't think I know if I answered that for you, but it doesn't change that graduation date. It doesn't have to change the graduation date.
Okay, there wasn't an absolute number that theirs got adjusted equally with the 170 days, then is what you're telling me.
Right. They're benefiting from the 10 less school days, if in their minds, I'm sure.
I'm sure. Thank you.
Seeing no further questions, I'll call for the vote. Kathy, how do you vote?
Yes.
Jeff?
Yes.
Excuse me, Don?
Yes.
Nicole?
Yes.
And George, yes. There it is, passed unanimously. Next item is the Mashpee Public Schools Learning Plan for school year 2021.
All right, let me share my screen. Let's see.
The chair will entertain a motion that we approve the plan as we have been given with grades 4 through 12 hybrid learning and grades pre-K through 3 in-person learning, with the firm understanding that this could change.
You're asking for a motion?
Pardon?
You're asking for the motion right now?
Yes, I am. Before we discuss it.
I would like to hear the superintendent.
So what I was just going to add to that was at each sort of grade range, pre-K to 3, parents were given the choice between being 100% in person or 100% remote. And we have started to collect that information. Today was the start of phone calls for those who have not yet responded to sort of the learning decision Google form. If a student chooses or a family chooses their student to be remote at that level, they are still going to be connected to their classroom and be able to blend in terms of some live instruction as well as some supported through an online sort of learning that the teacher has posted. So our classes at the pre-K to 2 building will be approximately 11 students in a class. And there is a good number who are choosing 100% remote. So the teachers are going to have even less than that sitting in front of them. But if you have 11, you could in theory be sitting there with 7 or 8 kids in front of you, and 3 remote learners will have been assigned to your class. And a seat will always be available for those students. So if at any time they choose to become a full in-person learner, that should be relatively seamless. So everyone, and I should point out, everyone in the hybrid models as well, everyone has a seat in case they choose to if they change their mind from fully remote. So pre-K to 2, why don't we just sort of stop there so I could field questions related to pre-K to 2, the Coombs School. Anybody have any questions on that?
So Patty, explain to me, you said every child has a seat, but if they're a remote learner,
They still have a seat.
So their cohort of 11
yes
individuals would have a empty seat for them if they're doing it remotely, correct?
Yes. So the homerooms are being created based on the total student population, but when we look at the data that's come in from the decision making, we're going to look at remote learners first and sort of as heterogeneous as we can. They will be divided up among the 8 classrooms or 7 there's 8, I think, classrooms. And then the in-person learners will fill out the rest of those spots up to the 11. So on any given week where it's in-person learning at that level every day, you may have 3 empty seats because those families have chosen to remote learn their student. But at any time throughout this year, they could say, well, no, I'm feeling better. I'm good at having my child be an in-person learner, and that we have them all set. They'll already be connected with the peer group, with the teacher. Should be pretty seamless. Anybody have questions on Coombs?
Kathy, do you have any questions?
No, I mean, I think that answers the one question I had, because that was one of the questions I had a parent ask me about, you know, like what was it going to look like if they had like would all the remote learners be in one classroom? But that just answered that. So thank you.
Okay, Jeff? Any questions?
Yeah, real quick. So I wanted to on the budget plan, and I don't want to get too much in the weeds, so I apologize in advance, Patty. But the Casey Coombs, I'm sorry, the Quashnet schedule for me was confusing in the fact that it had a group, and we don't have a lot of particulars about that group, and then the specials were listed above, but only one of the specials. So did I understand it correctly that like every 30 some days that special is going to switch to a different group?
Yeah, so if you are a 4th grade student, you may have art for the first 34 days every day. Then your special is going to change to STEM for 34 days. That decreases exposure for those specialist teachers versus in a normal week, they see every kid in the school building. So that's how that's going to work. And both of the schools are on a 5-day cycle, unlike in past years, it's been a 6-day rotation. So it's just within the Monday through Friday.
Okay, Jeff?
Yeah, thank you very much.
Okay, next is Dawn.
So I guess in regard to, we're now talking about QuestionNet.
Yes, is everybody ready to shift to Quash?
I have a clarifying question here. So you shared a document today that was our back to school plan. You said this was not what we were voting on today, but some of the discussion has referenced things that we've only ever seen in this plan. And so I'm concerned for the public who might be watching or here to learn more information about the district's plan, that there's no visual reference for what you're referring to. And so I guess I don't really understand the focus of this agenda item. Is it for the superintendent to explain the learning plan, or is she building off the conversation we already had a week ago or 10 days ago? And we're just, so can you clarify, Chair, for me?
Patty?
I think it's a combination of looking at a very, 34-page document that's very wordy, that is required for us to submit, but it's not necessary. And there's pieces that parents are definitely going to want to make sure they've read. And I intend to, after this meeting, to make sure this week everyone has seen it and it's communicated well. But I guess the difference, and I think that's what was in the email today, it's not approving this plan as a document, you are approving this sort of overarching concept of how learners will learn in Mashpee. There's a lot of details, operational details to each one of those components, and it's talked about in the plan, but the nitty-gritty of this 34-page document isn't what you're voting on. It's just meant to sort of supply additional information. And yes, it's going to be communicated to families.
Yeah, so I guess I'm just thinking about these meetings. So I've been watching of some other school committee meetings on the Cape for their learning plan discussions. And one of the things that we haven't shared is what I'm looking at on page 15 of that document. And I think it might be useful to just put that up as you're talking about each school, just shows sort of that draft master schedule so that people kind of understand when we're talking about, 100% in person, but what's the structure around that? What does it look like? I think, telling pre-K through 2 that we want them to wear masks is maybe not what they signed up for when they made their choice. So I just want to make sure those things are clear. But if that's, if everybody, I'm just asking my fellow committee members, do you guys think that that's necessary, or am I taking this too literally?
Well, I wanted to apologize for going into that, referencing the material. I did not read that email correctly. I thought this is what we were going to review and discuss tonight. Yeah, so that's my fault.
No, we absolutely can review. Let me see if I can.
We're not reviewing this document, then I honestly don't know what we're really voting on, unless we're just voting on that K3 is going to be this, and 4-6 is going to be this, and 7-12 is going to be this.
Well, from my understanding, basically you are voting on sort of the overarching plan, not the requirements within each plan that are DESE guided. I think partly for families, educating them on the difference between what remote learning was from March to June to what remote learning is going to be moving forward. They are not at all sort of the same animal, the expectation. And so this document will get shared with all of our families. I'll do my best to sort of do a walkthrough of the highlights as well. And so no, you don't have to read it all. But I think we have tried to emphasize so far in the previous presentation, which was more of the slideshow, that the hours were different, but you will be following a schedule as if you were sitting in the classroom. I think we've been pretty fortunate to create the plan that does really allow every student to be connected to their Mashpee educator or plural educators, depending on their courses. There will be that face-to-face. There will be actual instruction provided to the students in class as well as to the students at home. Everyone will have a device. So it will be.
Could you shift this up just a little bit, Patty, so that everyone can see? Yeah, perfect. Thank you.
Yeah.
While you're talking.
Yeah, so this is the Coombs schedule draft. Obviously, the students at home are not, that's why it's every student's day is 6.5 hours if you're sitting in a classroom, but if you're home and you don't have certain other things interrupting the day, you have less time. So it is 5 hours for pre-K to 6. So this is the.
So can you pause right there? Because this is where I had a question. So this, if my kid's a remote learner or either in person or remote, at 9:05, if they're at home, they log in.
That's right.
Presumably with me if they are 6 or 7. Right?
That is a hopeful, yes.
Yes. And then they have the morning meeting and then they go into their first instruction. Now that's not to say that a 7-year-old is going to be expected to sit at this computer from 9:30 to 11:35, right?
That's absolutely correct. So the teachers, whether they're creating sort of a slide deck of activities, my vision in my perfect little world is that the teacher will provide a live 15-minute explicit instruction like they would be doing in a class. Maybe it's a math lesson. And then just like students in a classroom are independently working, whether it's in a math workbook or something else, those students at home will be too. Now they don't have to, they can log off, or if they wanted to be able to access their teacher during that time, there will be a way for them to do that. But they are absolutely not, no student K to 12 or pre-K to 12 is expected to be on their computer all day.
And
but
then,
but just to clarify, they are expected to sign into each class, particularly middle high school, but they are expected to sign in at different times throughout the day for that sort of content area piece. And then there will be independent work time as well.
Patty,
I'm sorry, go ahead, Don.
so if a parent had a child in 2 different schools and you have the alternating remote learning,
right?
Does the parent have the ability to request that those be synced up so that both of their students are in the same cycle? So
they can request that, but they don't need to because we're doing it that way anyway. We would not have families be on separate cycles.
Okay, so you're consciously making an effort to ensure that a family's kids in all grades all have the same cycle of being remote or in person, correct?
That is correct.
Okay, thank you. Sorry, Nicole.
My kids would prefer to be on a different cycle, but but I told them they're going to be stuck with it. Is the pre-K dismissal time correct on this chart?
It's probably going to be slightly earlier than that. Last year and prior years, we had them end 45 minutes earlier, which allowed for less congestion and also for parents to, for teachers to have a prep. So that probably will get adjusted. That's probably not correct.
Yeah, I'm just wondering, I thought it was 2:50, so it looks longer. It looks like a longer day now for some reason, but.
No, and in defense to the principal, I probably put that in there.
Oh, and then my just for clarity, so this is the schedule. So what's different about this from the spring? You were talking about how you could emphasize that is one, they're attached to their classroom. Hi, Don. They're attached. I see you. They're attached to the classroom, and so. And then they have these explicit login times. In this case, we're looking at 9:05, 9:25, 12:25, for example. Those are all times that they are checking in. And then if we have to go 100% remote, this schedule stays. It's the same schedule.
That's right.
Okay. Thank you.
Yep. I don't know if you want to look at this one. This is Quash.
I asked one more question about the remote, just kind of piggybacking off that, Ms. Kathy. I guess, so the teachers though themselves will designate when those remote learners in pre-K through 3 will need to log in, correct? I mean, is it, they'll have that initial schedule that they will provide to the parents and the students, or will it be at the start of each one of those instruction blocks that they will have to log in?
Their teachers will have flexibility with that, but once they just need to make sure that they're consistent. It can't be sort of become a difficulty for families to figure out. So there is a desire to have some consistency, but I could see opportunities where a teacher may have them work on a writing assignment and then want them to share. And so they might want to sort of connect virtually a little bit later. So it depends, I think, the flow from day to day. But in general, every student will be provided with a schedule that tells them when they are supposed to be virtually connected to that classroom.
Okay, thank you.
It's a little hard to sort of, for me, to talk about this type of schedule when you're talking pre-K and K. It's not quite the same type of content. I mean, the content learning is very important, but the delivery involves a little bit more animation and movement, and it's a little different than as you get older. So
yeah, totally understand with those younger grades.
Yeah.
Thank you.
So similar would be at Quash. Just to go back to sort of the models available or the options that parents were able to choose at Quash. If you were a third grade family, a family of a third grader, you could choose between all in person like Coombs or all remote. So you had option A or option B. The same thing that we explained for Coombs. The remote learners will be assigned to each of the homerooms. It looks like we have 14 students per homeroom. What was our initial sort of swipe through. And so there again, I don't expect any teacher to have 14 students sitting in front of them, because there are families choosing remote. But just like at Coombs, they will be connected to that teacher and that learning every day and follow that schedule. And then in grades 4, 5, and 6, because of the challenges with busing, we weren't able to do the 100% in person, even though we had the spacing in our classrooms to do so. So we have adjusted to have them be hybrid, with the 1 week on as an in-person learner and 1 week as a remote learner. And those class sizes didn't have to be as small as we were planning when they were in-person learning. And so they are roughly 20 students, but only 10 will be there in any given week. And like I said, those who are choosing 100% remote will have a seat assigned to them when it would have been their in-person week. So if they choose to change their plans some way through the year, they will just switch and start attending, 1 week in and 1 week out.
Okay, questions on the Quash, Jeff?
No, I'm good, thank you.
Thank you. Kathy?
Nope, thank you. That works.
Don?
So Patty, this covers the Quash and also the middle high school. But on page 19, can you just elaborate in regard to performing arts and physical education and visual arts? What's going to happen, and what are we doing with those resources that were dedicated to those functions?
So we're not sure, where is that on page 19?
Right before health, safety, and well-being.
I showed on the top of page 20.
Okay, thank you.
Oh, I'm sorry, page 20. You're right.
So we don't know for sure the guidelines yet from DESE regarding physical education. That's probably going to happen. We just put this in here in case there is any kind of limitation to what we would normally be able to provide. So we're going to do our best to allow students to experience what they would normally, but we just need to give a little heads up that it may not be like they're used to or as robust as we've been able to do in the past. So these teachers will definitely be engaged with in-person learning as well as the remote learners. It just may not, it's not as easy to sort of transfer into the hybrid model as it is for other classes.
Thank you. Nicole, any questions?
Hey, George, just a follow-up. So you're saying that these classes will take place for those kids who are attending the individual schools in person, correct?
Yes, and if you were a remote learner, you would be able to connect as well. They just may not look like they have in the past.
I understand. Okay. I was concerned that we were not offering these classes during this time period.
No, it's sort of modified.
Okay, thank you.
Yeah, so my question was back on the Quashnet schedule. So first of all, I think this is, you know, I wouldn't even know how to do this. So bravo, sort of figuring this out. But so I thought you said at one point it was Mary Kate's idea to handle the specials like this. I think it's great, a smart way to not just protect the staff, but also just make sure that the kids still get some of these great subjects. Help me understand remote specials and what that will look like, because that was very variable in the spring. And so again, pointing out sort of the differences between what parents saw in the spring and this new structure. What can we expect?
Well, depending on the type of learning or the explicit instruction that the teacher is providing, students, regardless of whether you're in person or remote, will be able to participate in that. In terms of the activities, they may be slightly different in terms of what what your in-person learner has access to versus a remote learner. But I think that the teachers would be pretty creative at making them linked in some way. Obviously, you're not going to create a clay pot at home. Well, you might, but where you might do that. So I think they'll be looking at ways to create the activity related to the content or the standards and make it doable within the setting that the kids are in.
And the one thing that you didn't mention, I didn't see it in this plan, but maybe you didn't have to include it, but that that portal piece that allows a point of entry for parents to kind of come in and see, you know, have sort of one access point for all of their kids' scheduled instruction. That's also different now than what would have happened in the spring.
Right, and it is talked about in this plan, if I were to have to find it now, it's talking about how we're creating a district landing page.
Oh, okay.
And that there's a paragraph in there about the family will then just be able to, with one click, land in the Quashnet school, and with one click land in, you know, Mrs. Mayen's class. And so it will be much easier. And then in terms of turning work in, that is to be streamlined as well. So it's really just sort of a one-stop location for everything that a student would need to access for their learning and a parent would want to oversee or learn about.
Okay, and then the last thing I don't see on Quashnet's schedule is something like enrichment. Is there going to be enrichment in this school year?
No, Principal O'Brien, you want to refresh me on that? I believe no. But
hi, no, we are not going to have a separate enrichment class. We really felt it made the most sense to go to 5 specials, being a week on and week off. So we had to look at what we felt was the most important at the time and what really was better to change up. So we stuck with STEM, music, art, PE, and health. And we felt that health for all the grade levels was especially important during this time.
I don't know why.
And it is, health will also be a place where we can really infuse mindfulness and multiple different social emotional learning strategies.
And what about the WIN groups and things like that were breakouts that weren't specials, but they were like other places that kids would go together in groups?
Well, because we don't want to mix those groups of students, That time, it was a half an hour within the daily schedule, and I really think that's going to be taken up with either mask breaks, with hand sanitizing, bathroom breaks. So we will not be having a wind block, but the teachers I know will be differentiating their instruction, having students work at their level within the classroom. And knowing that the classrooms are going to be smaller, it is going to certainly help teachers be able to do that efficiently.
Okay, thank you so much. That's all the questions I have.
Okay.
Does anyone have questions on the middle high school schedule? So it's the same in that the hybrid, you can choose to participate in the hybrid, which is 1 week of in-person and 1 week of remote learning, or you could choose to be 100% remote. What I kind of, you know, we have one group of parents who probably are not having the opportunity to choose what they want, which would be totally in-person learning. So the only non-flexible offering we had was not being able to say for grades 4 through 12, you can have in-person learning. But I think by giving everybody sort of two options, we've done the best that we could to allow for some comfort zone for families. Just not, that's that one option that might have been something certain families wanted and we're not able to provide. The high school will be on a block schedule, so there's 4 blocks each day. They're here in the blue. If you are in person, you're sitting in these classes. If you are a remote learner for that week, you are also involved with these classes through your computer. Again, you're not expected to be on for the entire block. It depends on what activities the teacher is scheduling. There may be explicit instruction for a certain period. There may be independent work. They may come back together at the end of a class. There could be a discussion. So there could be partner work with an in-person learner and a remote learner, you know, through a shared document. So there's a lot of different ways to do that, but there is a commitment that we expect from our students at the middle high school to be engaged in their learning for these blocks of time.
Okay.
Patty,
Mm-hmm.
quick question. Are you saying that there will be no students at the middle high school that are attending classes in person every day?
Well, there would be a select population of students, probably students that receive special education services that, based on guidelines from DESE, would benefit from being in person every day, and those students, we will accommodate them.
Okay.
But they're a very high needs group. But other than those students, no.
Okay.
Thank you. And Nicole, one more.
Patty, can you explain how things like languages and electives happen under this block scheduling?
So you would have so you take 4 classes one day, and a student carries 7 classes altogether. The 8th class on the second day is sort of a extra help, project-based, maybe community service opportunities. So of the 7 courses, you may be taking Mandarin. That's one of your blocks. And that teacher well, Mandarin I shouldn't have picked. That's a very hard one for me to sort of wrap my head around, but let's say Spanish. There will be explicit instruction time. There will be different online, probably apps that will support learning, but it will be the same way. That's one of those, every elective or core course is part of those blocks.
Okay.
Yeah.
And the electives, I don't know when all this happens. I don't have a high school student, but they've already chosen their fall courses,
So
or they haven't, or?
Well, and probably Principal Balistracci can support as well. What my understanding is they put in their requests, like you fill out your want list, and then I believe, knowing that we needed to get our class sizes down, which meant we needed more teachers teaching core classes so that we could have more sections. Some of the electives we weren't able to offer, but many of them we are. And so students should still be able to take those. The the cohorting, which is what we're starting on tomorrow, is a rather large undertaking because it has to start at the middle high school level, 7 through 12. And if we cohort sort of based on bus routes, then you have to look at where these kids, these students have been placed. And then you might have to adjust some of those placements because you can't obviously have 17 students land all in the same week for a certain class. And so once we work out that, then from there we can do the grades 4 to 6 because they have to be cohorted during the same weeks on and off.
Okay,
So
thank you.
there's a little bit there.
Okay, are we all set with this and ready? Kate, to make?
I have one more question. So all the after-school clubs and stuff has been discontinued during this time period, correct?
Yes, pretty much. In speaking with the association president, once the school year begins, we're going to look at each sort of stipended offering and determine which ones could possibly meet remotely. We're not planning to have kids after school or a late bus, but there would be certain things that could probably function remotely. So we're going to kind of look on a individual basis at each of the offerings to see what we can and can't do. But as a general statement, a general paintbrush is that we're not.
Okay, thank you.
Okay, can we, any other questions? This is not the document we're voting on. We're voting on the overall.
You're really kind of voting on this first page, but just so you know too, this was originally due today, but DESE changed the due date to Friday. So, if you are let me get back to the first page here. If you're getting, if you have any questions when you get, where is it? Oh. Anyway, if you have any questions, right here it is. As you read through this document, just let me know between now and Friday when it has to go in. Yeah. And between now and then as well, this will be shared with all of the staff and the families as well. It'll be posted publicly as our draft plan on the website and probably sent out as a link.
Okay.
But it is kind of a bulky document. But it does have the details for those who want to look versus just the slide presentation we did in the past.
Thank you, Patty.
I'm going to stop sharing.
I think we're now down to the point where we can, I will be able to entertain a motion that we approve the overall plan, which is hybrid learning for grades 4 through 12 and in-person learning for pre-K through 3. Hybrid learning will be 1 week on, 1 week off. And with the understanding that this could very easily change. And with that, I'll accept a motion.
And this is Nicole. I move to approve the Mashpee Public Schools Learning Plan for school year 2021.
Thank you, Nicole. Is there a second on the motion?
Second, Don.
Thank you, Don. We have a motion by Nicole and a second by Don. Any discussion or comments on the motion? Kathy?
One last question. So if somebody picked, if they picked remote, they are able to definitely, I think you might have said this and I'm just scatterbrained a little bit. If they picked remote, they will be able to transition back in person if they choose to as the weeks and months move on, correct?
Yeah, so for pre-K to 3, they could transition to in-person. For 4 to 12, their only option is to transition to hybrid, which gets them in 1 week.
Yep, okay.
All set, Kathy?
Yes, thank you.
Jeff?
And just to clarify, there's not really 1 week off, correct, George?
No, it's 1 week remote.
1 week remote. Did I say off? Sorry, sir. 1 week remote, 1 week in. Thank you.
And I don't think there's a huge amount of students listening, but I bet there would be cheers if otherwise. Yeah. So
Well, whatever you need to do, you know. Thank you, Don. I'm sorry, Jeff. Don?
Yes. Oh,
Any other comments?
oh, no other comments.
Okay. And Nicole?
Yes.
No other comments?
No. Oh, I thought we were voting. No, I
I
don't have
just
any.
wanted to ask if anybody had any final comments before I call for the vote, just to, I have, I know I'm supposed to do a couple of things here, and that's keep the meeting on time and not participate in the discussion. But this has been so important that I've just let this roll so that all of you would have the opportunity to ask any questions that you might have. And this is an item I certainly, when I took out my nomination papers, never thought I'd be voting on something like this. And for the members of the public, you know, we're not doctors, we're not epidemiologists. We're certainly not experts in the transmissions of infectious disease. And you've heard today, you know, guidance from those people in that area who are expert. We have spent several days, I have spent time as a member of the committees going over the in-plan, the hybrid model, the remote model, the in-person model. And these were consisted of, you know, all sorts of people, stakeholders in the operation, the staff, the faculty. Everybody had a fact into this, and the district has spent untold hours involving the parents, the students, the staff, the faculty, the administration, with the overriding thought that safety is the prime consideration in anything that we're going to be doing as far as the schools are concerned. And with that, I'll call for the vote on the motion to approve the plan. Kathy, how do you vote?
Yes.
Jeff?
yes.
Don?
Yes.
Cole?
Yes.
And George, yes. It's passed unanimously. Next item on the agenda for discussion is the parent guardian learning plan. Decision documents.
All right, I was just going to share my screen, and I think Dr. Hanscom was going to briefly overview this, but this is as of today, the results of the Google form. And I know that principals have started to call families who did not respond to the survey or to the learning decision form. It's not a quick conversation. It ends up being a little bit longer. So that's a slow process that they are going through, but all questions are good. So I don't know if you want to just want me to walk, or maybe Dr. Hanscom, do you want to walk through just some highlights?
Yeah, I was just going to give an overview of sort of the survey itself, when it went out, what the response was due, and what the next steps are now that we're getting the data. And then if people have questions, I'm happy to answer. Does that work?
That works.
Okay. So we sent the questionnaire out. There were 4 decision-making forms that went out, one for pre-K to 2, one for grade 3, one for 4 to 6, and one for 7 through 12. And they all had the same questions on them, more or less, mostly more. The grade 3 survey that went out, we didn't ask what grade their student was in because it was only going to grade 3. But otherwise, the questions were the same. And it was very simple, just the student's name and grade, and then the parent's decision for the student for the fall. So for pre-K through 3, they could choose, and we heard this already in our learning plan, between 100% in person or 100% remote, or to apply to homeschool. And then for grades 4 through 6, they could choose the hybrid model or 100% remote, or again, to plan to apply to homeschool. The survey went out Thursday, July 30th, which was the day after the last school committee meeting we had, which we wanted to make sure, and I'm glad we did because we changed some things as a result of it. And it's not a survey, I should stop saying that, the decision-making form. And we asked families to get it back to us by Friday, August 7th. We sent a reminder email to families on Wednesday, August 5th. so far. And so we got the data back Friday. Most of us were gone last week, so we've really had this morning and this afternoon to look at it. So I would ask you, if you're looking, if like Don, I'm going to ask you to put your calculator away. I'm going to ask you to just do that politely and kindly and say, we need a minute for number talk. But if we're talking big picture, it's looking primarily like most families are choosing to have their children come in for whatever that looks like. And it's actually looking like it's falling into that same 70-30 realm that we saw in the previous survey, which was a survey where we asked what they were thinking at that moment in July. So where we are seeing about a 25 to 30% families choosing remote, and that's across all the grade levels. And then some homeschools. I don't oversee the homeschool program, so I don't know, Mrs. Kett does, how many homeschooling families we had before. So that's something we'll look at. But for now, we're really just taking this information and then we're going to start to cohort. In addition, we asked if families were going to choose to drive their child or have their child drive themselves for those 11th and 12th graders who could, or were they going to take the bus in a variety of ways. The way we're analyzing that is to look at anyone who's going to take the bus for any reason, whether it's AM or PM, it doesn't matter, or both, they're counted as a bus seat, and anyone who's driving is counted as a driver. And so we will then start to look at the existing bus routes, see if we can fit in the existing bus routes to make our cohorts, or if we're going to have to reroute. That's going to be the work we do, I don't know, forever, like for the next, until we're done with it. So starting tomorrow until forever. The other piece to that is I wanted to make a comment about the switching from remote to in-person. And that will be an easier switch than a family switching from driving their child to not driving their child. So if, for example, I filled it out for my son who's going into 6th grade, and I said we would drive him. If my family, we decide that we can't do that anymore, you can call us and we will work to get you on a bus, but it will not be that quick turnaround that it is for kids to be able to switch learning models, because we don't have the capacity for that. Will it happen? Yes, we are required to make it happen, so we'll have to figure it out. But if you've said you're going to drive, then you really have to continue to do that. And if that circumstances in your family change, then please turn that off. Sorry. Then you'll need to just give us a little bit of time to work that out. So I wanted to kind of publicly make that clear. Yes, Mrs. Bartlett.
This is Nicole. I just have one question because we're looking at the screen. So these are now students. In other words, that when we're in the yellow, they're 64. That's total students,
Correct.
not households.
Correct. Yes.
Okay.
So I'm not using this chart as much, like I'm moving my mouse on it and I'm realizing that none of you see that.
Yeah.
So I'm not going to speak as much to this chart because I didn't create it, although I've been looking at it today. I'm more going to give you kind of general numbers and general processes and sort of the overview of where we're at and where we're going. But that's the data as far, I think it was like 2 o'clock today, Patty, is that right? Somewhere
Right.
around there.
And at this point, we need the actual head counts in those different options. It doesn't really matter anymore. We're going to call everyone we haven't heard from. So we just need to know the actual bodies.
So, sorry, go ahead.
I guess what you were saying about the 70-30 split, I guess I was just curious, are there households, I'm just curious what the total district proportion is. You don't quite know that yet, right? Overall.
Well, it's 4 spreadsheets, so I haven't combined them yet.
All together yet.
No, not yet. And truthfully, I will eventually, but it's not high on my list because we're not cohorting by district. And for now, our focus is 100% on cohorting and figuring that piece out. But in the meantime, we do have the list of families who have responded and the list of families who haven't. And getting that data is also happening simultaneously. So we'll have 100% by the end of this because we have to.
And Nicole, if you're looking at the Quashnet yellow there, where that's in person, there's 105 third graders on the books right now. So that you know, you can say, okay, 64 out of 105 are going to choose in person. As
Yeah.
of, you know, right now in terms of what we have.
Yeah, so it's just based on who you've talked to already. And I'm just curious, you know, if you have kids at different schools, you might opt to do one hybrid and not the other. You might make a different choice based on where your kids are.
So I thought that too. And last week I was on vacation, but Wednesday and Thursday morning were sort of my work days, you know, just to, because otherwise I would have exploded when I came in today. And I went through every spreadsheet on Wednesday, and that was one of the things I was looking for. And I believe there was 1 or 2 respondents where one student was going to be home or, you know, remote, and one wasn't. Overwhelmingly, families decided to do the same approach for their children. Again, that was a very quick Wednesday look. I don't know since then where we landed. And then we also looked at transportation. So like I said, we've got the numbers to date of how many students will need transportation so that we can fit them on the buses. Because like we said 2 weeks ago or whenever we met last, we can fit 23 students on a bus. So where these students live is going to determine whether their bus route is, whether we're going to be able to keep the same bus routes or not. And that's the work we're doing this week. So our next step is to take the results of the survey, the results of the decision-making forum, the head counts, and start to make those cohorts that Mrs. DeBoer was referencing. We're going to start looking at the students who fall into the high needs category on their IEP, of whom there are very, very, very few. They'll be placed along with students who receive English language education services, and then our remote students, and then we'll sort of place the rest of the students accordingly. So placement letters might go out a little later than on a normal year. I think Mrs. O'Brien and Dr. Goulart wanted to make sure that was clear, that we'll do our very best, but it may be a little later than when we thought for placement letters. So that's, I don't know if I missed anything, Mrs. DeBoer, but that's where we're at. And I'm happy to answer anything I can.
Kathy?
This is Kathy. So you're starting to call the families who didn't reply to the forms, the decision forms today. Is there it's kind of a 2-part question. Is there a deadline to when they have to get back to you? And if they don't get back to you, will a decision be made for them? Will it be assumed that they will go with the hybrid and need transportation just to secure a spot, so to speak?
That's a great question. I would say the deadline for them to tell us was Friday, August 7th. So, but I tend to be a concrete thinker. But no, I mean, our staff, Mrs. Pagano was making calls today, Mr. Kapulka, you know, all the different folks are making calls. And while the conversations might end up being longer, I believe the decisions are happening in those calls. We will continue to work to reach every family. But what you just said was something I hadn't considered, and is a great idea. So I guess I'll leave it to the rest of my team to decide. But I think, yes, if we really can't reach someone for whatever reason, we would consider them to be an in-person or hybrid learner and need a bus, because otherwise we have to at that point.
And the phone calls that are getting made are not like, hey, please do this, please fill out your Google form. They're filling it out while they talk to the parent.
Right, live.
I figured that was it. I figured it was a call to say, these are your choices, which do you choose? So thank you for confirming that also.
Yes, exactly.
But thank you.
Thank you. Any other quick questions? As we know, this is just a preliminary output of what we've had so far, and there's still additional information to come. But any other questions before we move on to the next item?
So this is Don. I have one question or comment. One of the things that was lacking in this form was information in regard to how services are provided or will be provided for those individuals who are receiving additional services under IEPs, etc. And therefore may have skewed potential results.
May I? Oh, sorry. Can I clarify what are you saying? may have skewed results as to whether they are determined to be high need?
No, the results in regard to whether an individual would have chosen in-person or versus remote versus homeschool.
Okay.
And it's my understanding that even following up with our special ed department, people are being told, this is what I'm hearing, that information won't be available until the beginning of school. So I'll just put that out as an FYI.
Well, that's interesting. And Dr. Curley's on the call, so she can certainly answer this. But I would just say that what I've heard is that there will be meetings for students who receive specialized services in the first 2 weeks of school that will determine what their individual learning plan is going to look like based on their plan.
Right, but those will happen after the beginning of school.
To just adjust the IEP if needed. But all those students have IEPs currently, and those IEPs we're obligated to fulfill under any circumstances. So I guess, again, I'll have Dr. Curley speak to this more, but I guess what I would ask you, Don, to tell them is that whatever they have as an IEP, we're legally required to implement.
Yeah, but it's my understanding, though, that during the spring, we didn't actually do that. We didn't follow them because of all the issues with remote learning, etc., and trying to figure out how to provide services. So are we saying that we have figured out how to do that for all of those 300 kids that are on plans?
So Dr. Curley's going to speak to that.
Yeah, I can speak to that a little bit, Don. So in the spring, we were told from the Department of Education that we were to do remote learning plans for all of our students, which we did, and that services would look different during the remote learning than what they would normally be when they're in school.
Right.
So that's going to kind of continue to be what's going to happen when students are at home getting remote services. The services might look a little bit different than they would when the students were in the building. Our IEPs will be written and will continue to be written for services as if a student was in the building all the time, 5 days a week. But we will be providing remote learning plans again this fall based on what the services will look like when students are in that hybrid model. So it might be when they're in school, this is what it's going to look like. On the remote weeks, this is what's going to look like. So those will all be completed in consultation with the families. And then provided to families, and then obviously a phone call or a meeting can be held to discuss any concerns.
And when will that take place?
Well, it'll be hopefully some of the time, and we need to talk about this as a team, but I'm hoping that some of the time can be done in those upfront, some of those 10 days prior to the school beginning. But certainly, I don't know if it'll all be finished within that time period, but certainly started during that time period. And if it can all be finished, that would be great. And then moving forward into the, first week or two of school. But if it's done ahead of time, then, that's obviously the goal.
Okay. No, that sounds good, because I think advising those parents in regard to what the expectations are and the students in regard to the expectations, particularly since it's going to look different, as you point out, so that they can be prepared of what and understand what the expectations are. So thank you.
Yep, you're welcome.
Any other questions for Dr. Hanscom? Okay, thank you. And both Dr. Hanscom and Dr. Curley. And the next item on the agenda is school budget update, COVID-19 expenses.
So just briefly, we're going to talk about this in more detail at the next week's meeting. I believe Wednesday, the 19th, we have a meeting. But overall, other than the PPE supplies, staffing were in pretty good shape because of the hybrid model 4 through 12. We didn't have the same need that we have, pre-K to 3 to create smaller class sizes, which require personnel. At the Coombs School, we've been lucky to have one was at Quash, but 3 paraprofessionals who are licensed educators are shifting into being classroom teachers. So obviously there is an impact there on the budget. So we will assess the need to replace their para positions. In most cases, we do. We have had some paraprofessionals, predominantly paraprofessionals, choosing to retire or resign for various reasons. So that seems to be a little pool of need that we're going to address. But I don't see anything significant right now that can't be covered under the COVID money that we're expecting to receive. And then I know we talked about it with the town. It's really is important to me as well as to our teachers association that we do have the extra day custodian in place at each school building, because there are a lot of little things that need to be attended to that a normal day custodian won't be able to. And so that is something that is really important to me. And I hope that through the COVID money on the town side, they can choose to hire temporary day people or shift someone up and hire a temporary night person or a substitute whose sole purpose or role is, you know, walking around every day, hitting as many common areas and bathroom stalls. And even a classroom could be disinfected when students are not in it for a 45-minute period or whatever period of time there is. There are options to sort of hit some areas a little bit more. But we'll have a little bit more detailed of a list at next Wednesday's meeting. But I don't think you should have any worries about that right now. And in talking with Paul Funk, he says we're in a good place right now.
Should we put a vote for a hiring like the town manager wanted as a vote for next meeting? Once we know what the numbers are.
Yeah, you could include, I suppose, for your next August 19th.
Okay. Any other questions? Nicole?
Yeah, what about the bus monitors?
So we are looking to hire them. We already had bus monitors, so there will be an impact of that, but it shouldn't be significant. But that is on our list. We have a sort of a running list of things we need to make sure that Dr. Hanscom includes in her request for funding through DESE, and those are on there.
And how much, so you're saying that of the 200 or so educators that we have in Mashpee, what is the number, like 215?
Actual like Unit A members is about 164. I think Dawn has.
I was including the paras.
Yeah, so the paras, yeah, get up to a little over 200, like 225.
Okay, so of the 225 staff, we don't have any major shortfall in terms of what we need. And I'm just thinking about people who decide they can't. I'm not trying to preempt our next topic, but as a financial matter, are you saying then that the only staffing needs that we might have are to replace some paras?
Right now, it's replacement of paras and bus monitors.
And
there
custodians.
could be teachers. There could be teachers who make different choices, but that should, you know, whatever choice they need to make for their family, we should be able to handle that. We're going to send this draft plan. So in conversations with teachers that principals have had, where one particular teacher indicated they were leaning towards not being able to return because of their own health issues. But once they found out that the model had gone to hybrid in grades 4 to 6, and that there would only be 10 at the most, 10 students sitting in front, that teacher was good with participating in that in-person piece. So what we want to do tomorrow is send out sort of the commitment from staff, knowing they need to know what they're saying yes to. And now we have that all detailed, they'll be able to better understand and give us a firmer commitment with their plans.
Yeah, I guess that makes sense. It's interesting. I kept wondering, like conceptually, how you do the learning plan without the staffing plan, but then the learning plan informs the staffing plan because they're going to make decisions based on what learning model they're in. So right. That makes sense. Okay, thank you.
Thank you, Nicole. All right. Finished with the budget. Next item is the location, the August 19th, 2020 school committee meeting. I think you all know how I feel about it. I now think that we are asking the students and and everyone else to come back into the schools, that we should really consider having our meetings live. I'm thinking that it would be the 5 members of the school committee, the superintendent, the assistant superintendent, the business manager, and the secretary, and then anyone else that the superintendent thinks absolutely has to be at the meeting, but the actual physical presence will be small. I'm on the agenda for the selectmen's meeting this evening, and I know they have some sort of a system where they call, and I'm not sure how it works out, but it seems to work out well for them. And rather than reinventing the wheel, I'm going to ask them how they do it and operate in the same way, so that the members of the public can actually call in and with any questions that they have. But at any rate, before I wax on for another half hour, what are people's feelings? Kathy?
I mean, if it does make sense, if we're all getting ready to get the kids back in the building, we probably should start with the smaller groups as you proposed. I know the hearing issue last time when we were split, half virtual, half in person, was very difficult. And obviously we'll be taking precautions, I'm assuming, we masked and socially distanced. So I guess I'm leaning towards yes, maybe in person, unless things obviously in the next week change drastically. But I can see the benefits of it and how it is important for us to start trying to get back to some sense of normalcy.
Thank you, Kathy. The one other thing I forgot was Mashpee TV. They would also be there. Jeff?
Like always, I'll defer to the Democratic, but if there's no reason to bring extra people into the schools, I don't think there's a reason to bring extra people in the schools. So.
Okay, Don? There you go.
There, I mean, I'm fine with meeting in person as long as everyone's following the guidelines and has their masks.
Okay, thank you, Nicole.
Yeah, I think that's fine. I think that I don't find the in-person meetings with all the audio challenges to be terribly efficient. So I'm hoping that at this next meeting on the 19th, we'll have addressed the problem with the audio if you're remote. So if our principals or other folks are still going to be remote, let's see if we can't get a practice or something in advance. I understand Sean thought he fixed it for last time, but it was not great.
Not working.
And I think the majority of the public, if they do come in, are gonna, they're obviously, we want them to come in through the Zoom, not show up in person. So, yeah, it still seems, I don't know, it still seems odd to me. So we're trying to follow the policy that we are putting in place for the start of the school year, which happens a month after the meeting next week.
But the teachers are coming back on the 31st.
Yeah, but the teachers won't all be meeting in one room.
No, they'll be in their own rooms.
Yeah. So, I mean, I'll go along with it. I still think that it's, we should be driven by what's necessary and what's, why we have to do our business in person. But I think the main thing is just making sure that the public is clear and has a point of access. It's a little confusing to be meeting in person and then deny the public access.
Yeah, can't happen. The public has to have access. And if any member of the committee or does not feel that they should not be present, then, well, obviously we'll take care of that also, because that's the same choice we're offering everybody else. So I'm gathering with at least 3 people, plus myself 4, that we are talking about meeting in person on the 19th. Do we need to have a vote on that? I don't think so, because we went to remote without having a vote, but Any parliamentarian or any comments on that?
Only
Hearing-
that it's on the agenda for a vote, I believe.
You are correct. It is on the agenda for vote. So I will accept a motion that the school committee start meeting in person, starting with the August 19th meeting.
Can we clarify the motion, George, that whoever makes it, that this is, that the committee's meeting in person, but the meetings are not open to in-person public participation?
Yes, let's try that motion again, that the school committee will meet in person starting with the August 19th meeting. The people who will be there will be the members of the school committee, the superintendent, the assistant superintendent, the business manager, the secretary, and Mashpee TV. It'll be limited to that, plus anyone else that the superintendent feels absolutely necessary to be at the meeting.
So moved.
And moved, is there a second?
Yeah, I'll second it.
Motion's been made and seconded. I think we've discussed it, but any further discussion on the motion? Hearing none, I'll call for the vote. Kathy?
Yes.
Jeff? Whoops, that's from me.
Yes.
Dawn?
Yes.
Cole?
Yes.
And George, yes. It passes unanimously. Next, from the superintendent, employees COVID-19 scenarios.
So I shared, let me go back to this document with the committee, I think when I sent it out to all the staff members in terms of helping them better understand options available. I don't know if you have any questions. This was as an FYI, and I think that Mr. Gorman had asked some question at the last meeting about being able to talk about employee options. Does anybody have any comments or thoughts? There's quite a list here of scenarios and what governs decisions related to the choices. So it's lengthy, but it's thorough.
Yeah, thanks, Patty. Yeah, I was also asked since the last meeting. I attended the TUME webinar on the HR questions. So I've been fully briefed ad nauseum about I should not ask the question, but I'm very comfortable now. Thank you.
Thank you. Anyone else have any questions for the superintendent on this document? Nicole?
Yeah, the only question that I had sent in was just to clarify that if a teacher is asked to quarantine because someone in the classroom or in that cohort is, it'd be through contact tracing, they're asked to do so, that they will not have to use their accrued sick leave, even though they are home. That was just a question I had asked Patty in advance. I wanted to make sure everyone had the benefit of that answer.
Yeah, that it's correct that the employee is given 2 weeks of leave and they do not use their own personal accrued sick leave.
Thank you.
So I'm sorry, and for me, for clarification, so if we have a teacher who, due to contact tracing and close contact guidelines, has to quarantine for the number of days required, they will not be, they're not going to be asked to work remotely. They're going to be off the books.
Yeah, because in every case, we have to have a body in the classroom because there are kids in those classrooms. So we have to have someone in there.
May I just clarify? Can I ask a question then to clarify Mr. Gorman's? It's if they are quarantined as a result of close contact in school, right?
Yes.
Okay. Sorry, Mr. Gorman, for interrupting, but I wanted to clarify.
But if we had a teacher on hybrid, the close contacts are both cohorts.
Yeah.
Right. Right. But
so everybody would be remote. So why can't the teacher just teach that class remotely for the 14 days in conjunction with the cohort that's already quarantined for 14 days?
That's true. Potentially that could happen.
Sorry, I wasn't suggesting that they didn't work. I was just saying that if they did have to miss work, as like maybe they have to go get their COVID, like whatever, they're quarantined, that they're not going to be charged sick leave because they're home, that they would be working, or doing whatever the district needed them to do. That was that was the question, but.
But that was close contact in school. If there's close
Yeah,
contact
as a result
in
of,
their life, that's a whole different story.
Yeah.
They would use their time. Okay, I wanted to clarify. Thank you. Sorry.
And I do realize it'd be much more problematic in the high school, correct? Just due to the number of second and third order ramifications there. But yeah, pretty appreciate it. Thank you.
You?
Right. Oh, I'm sorry, Don, you were gonna go.
Yeah, well, my question just to Patty was, there's a number of scenarios here where people have to notify HR, and it's not a simple process for them to resolve, I think. So I guess, do we have a sense of how many potential individuals might be in the pipeline at this point or not?
Other than my making assumptions, no. We have a couple of people that had some plans for the fall, and so they're kind of wanting to change those up. But until we share sort of what it really looks like, sounds like, all of the pieces that a teacher would want to know about their work environment and the expectations, I don't think it's an easy thing for them to make that choice yet. So we should have that. We'll have that by the 19th for sure.
Oh, yeah, I would think. Okay, thank you.
All right.
Yeah, I was, sorry, just to pick that up, George, I just wanted to say, and I guess Mary's not still on, I don't see her, but I think that one of the, I don't know, I didn't feel very connected to hearing about teachers. I mean, I think you handled that through the process that you had for the different learning models, and teachers were engaged in those decisions. And I understand that the Mashpee Teachers Association has been involved from the start. And on the last meeting, you know, Mary commended you for your due diligence. And I just, I noticed there's, you know, nationwide, there's a lot in the news, and even districts on the Cape, very contentious issues around teachers and staff. And I just wanted to say that that was a large concern of mine, and I'm not hearing that from our district. And I wanted to, I don't know, maybe reassure parents who might be concerned about that has been happening all along, and it maybe hasn't been a very public process, but that's been ongoing. And so we didn't have an opportunity in school committee. Wasn't that the teachers came in and addressed us or said anything, that's all been happening through sort of normal channels and through those parent and student and administration driven learning development teams. So I just wanted to make that clear.
And just to, you know, we're really working collaboratively. So I've met multiple times. It's just myself and the union president, Mary Stickley, have been meeting. We expect that an MOU would be ready for a school committee signature on the 19th. But I did ask if our district of employees were looking to go, you know, 100% remote, which is what you're seeing in so many areas, and she said no. So I think making sure that we sort of Mashpee focus what's going on with Mashpee, but also making sure, I think, that educators are supported and know what we're doing to make sure that the work environment is safe for everyone will go a long way. And every district, as much as we're trying to be very cohesive on the Cape, it's different everywhere. And so it's not quite as easy to be totally in lockstep with each other. And the union involvement has a lot to do with that.
Thank you.
Mm-hmm.
Thank you. All right, next up are policy updates due to COVID-19 pandemic, and there's a bunch of them. By our policy here, the first people to look at this is the policy committee. And
Mr. Chairman.
Yes.
I move to send these new policies to the policy subcommittee and then to be presented when complete.
Second.
Made, seconded. Any discussion on the motion? Thank you, Jeff. Thank you, Nicole. Kathy?
Yes.
Jeff?
Yes.
Dawn? Unmute, Dawn. I know it's yes, but just unmute.
Yes.
And Nicole?
Yes.
Okay, and myself, yes. So that passes unanimously.
And we're meeting on August 12th, just an FYI, the policy subcommittee is meeting Wednesday.
Okay, consent vote. This is my attempt to try and speed things up a bit. For those items that are non-controversial, we lump them all together, and the motion is made that we consent to approve. Items that could go on there would be something like minutes from prior meetings, the item that was on here this evening, policy updates, that would be a consent to refer to committee. Adjournment could be a consent vote that everybody agrees, rather than taking 3 separate motions and 3 separate votes, just vote one. Any member of the committee could remove anything that is on that list for cause. If there's a minor correction, say to the minutes, a typo on page 4, that can be taken care of and still be a consent vote. So how do people feel about that? It's mainly an effort to speed the meeting up a bit. Kathy?
Yeah, yes, that sounds fine.
Okay, Jeff?
I don't have any issues with that right now. Yeah, it sounds good to me.
Don?
In concept, I don't have a problem with it.
Yeah, wait till we try it the first time and see what happens. That's probably what's going to be the best.
Exactly.
Okay, Nicole?
Yes, same.
Okay, and George, obviously, since I mentioned it, is in favor. I do not know of any item that we could possibly bring up here that we haven't covered. We now have an opportunity for public comment.
Hey, George, I have one. Just
Sorry.
2 seconds. I just want to let everybody know that I'm still designated as a single point of signature for warrants. So we can either dispense with that right now, or we can wait till the next meeting. But if we're going to be meeting in person, then clearly we can all go in and sign warrants in the office.
Okay, I thought that was the chair, that the vote was that the chair would sign them, because I've been going in and
Oh, you know what? I believe you're correct. I believe you're correct.
going and signing them. Once we start, we can vote on, we have to bring that up for a vote again at the next meeting, but we'll definitely do that as an agenda item, that we now go back to the 3-person signature. But thank you, Jeff. If any member of the public who is out there would like to say anything, on the bottom of your screen, there's a thing called reactions. If you just click the hand going up, or you could type in the chat function that you wish to say something, or just type your name and I'll call on you. It's a little bit difficult because I got a couple of screens here, but so far I'm not seeing anybody. I'll give everybody about 15 seconds to do that. All right, I'm not seeing anybody, so I will close the public comment portion of the meeting, and we'll ask for a motion to adjourn.
This is Kathy. I make a motion to adjourn.
Kathy, second.
I second.
Thank you, Nicole. A motion is made and seconded to adjourn the meeting. Any discussion on the motion?
I'm having too much fun.
Pardon, Don?
I'm having too much fun. I can't figure out when you mute me and when you don't mute me, George.
Everybody's muted, and then when it's your time to speak, I unmute you.
Okay.
Ask you to unmute, actually. I'm glad you're having a lot of fun with it. Where were we? Oh, yeah, for the vote, Kathy.
Yes.
Jeff.
Yes.
Dawn.
Yes.
Nicole.
Yes.
And George, yes. It passes unanimously. Thank you all for being here, and we'll see you all next Wednesday at, that's the regular time, correct? We're not meeting early.
You might want to we might do an executive for the MOA.
Okay.
All right, let me know.
We will.
All right, thanks.
Thanks.
Bye.
Have a good night.
Thanks all.